So today what I want to talk about first is the problem with mental health diagnoses. And with that, I want to also tell you about this concept of heuristics. So in order to exemplify that, I want you to think about the game of baseball. And in baseball, one of the central parts of it is a pitcher throwing the ball over the plate, right? And then it's either a ball or a strike. The question is, what makes a pitch a strike? Now, the first thing that you're likely to think about is about where the ball is over the plate, right, height and width, and that's how it's a strike or not. Well, if you believe that, you're actually incorrect. It's a strike because the umpire calls it a strike. So it has this certain amount of subjectivity to it. So you have an objective action subjectively defined. And so when you think about mental health diagnoses, they are not objectively defined. So what they do is the person, whoever the diagnostician is, looks at a series of information which is profoundly limited by the quality of the information they're able to gather, right? So they have to be able to assess skillfully, they have to ask the correct questions, and they have to then be able to interpret the information correctly. And out of that, they get a series of data points, and from there they construct a diagnosis, a heuristic, and they call a strike or a ball. Now, as we know, if you watch any baseball, clearly they are incorrect frequently. And so what you'll notice is just the same as a mental health diagnostician will frequently incorrectly diagnose people with issues. And in the world of psychology, there's a huge problem between the research psychologists and the clinical psychologists. The research psychologists are able to define and determine variables and maintain controls over studies, where in the real world, you don't have that. So I want to tell you a story of, I think his name is John Frusciante. He is the guitar player for the Red Hot Chili Peppers. He heard voices, and he used hard drugs. Now the question is, which caused him to hear voices? And then, of course, if he didn't use drugs, would he have heard the voices, or would they be as intense? And then also think about people who have trauma in their lives. They often hear voices, but they're not schizophrenic or using drugs. So what is actually happening? And so in this case, you have a certain aspect of our humanity that gets intensified for some reason or other. Now, we know that people who have slightly psychotic tendencies tend to be much more creative, which is very useful if you're a musician or a poet, right? Much less useful if you do concrete work like being a mathematician or a scientist. Now, the question is that actually a mental health problem? Now, currently we use something called the DSM-5, and most diagnoses in the DSM-5, which is from the American Psychiatric Association, include two qualifiers. One is, does it cause subjective distress for the person who has it? And two, does it actually cause them functioning issues? Now, the first one is very, very subjective. The person gets to determine whether or not it bothers them. The second half is how they function, and that's really a question for them, or is it for society? So, that being said, you could hear how the John Frusciante guy, if it helps him be a better musician, is it actually a mental health problem, or is it a gift? I once remember talking to a guy. His wife completed suicide, and he was always kind of dealing with depression in his own world. And one of the things that he told me is he also had OCD. He told me that after his wife died, he really had to stop and look at how much was OCD an issue in his life and how much did it affect his depression. And he told me that he's Jewish. He told me that being Jewish put his ancestors in situations that are very untenable and very difficult, and also that it limited the career choices that they had throughout much of time. And so that the jobs that they were able to get tended to be banking and money and certain trades, right? And he said that with banking and money in those trades, it actually benefited his ancestors to have OCD because it allowed them to be able to protect themselves and their culture and race in a way that if they're less focused and attentive. So, with all that to be said, one of the problems we have in modern society is that we overvalue the name of something. We want to say, if I have this, it means this. It's an issue of control and power. And there's also confusion in the nature of diagnostics. If I have a broken finger and I can see it's crooked or bent in some way, like they can look at an x-ray and they'll know whether or not it's broken. We want to ascribe the same amount of power to other diagnoses, but we really can't do it. So with that being said, please be kind and gentle. And remember that there's a huge movement within the mental health world to minimize the amount of diagnoses they give people. And I'm going to follow this up in just a moment.